Ladies and gentlemen, welcome. We are so excited to be here at Merit Medical on this very momentous occasion. Governor Herbert and I are honored to be hosted today by Merit Medical, a true shining star in our state. Weeks ago, Governor Herbert put out a call to all of Utahns and to all Utah companies, asking them to consider how they could contribute to this cause, protecting Utahns, our families, and our frontline workers as we work together to combat COVID-19. We asked for homegrown Utah solutions to our problems. Someday, someone will write a book about this, the adventure to find the gear and the testing solutions that were needed, and some of it will be unbelievable. But what we knew was that supply chains were being disrupted all over the world as every country and every state in our nation looked for ways to increase testing capacity. One of the biggest problems that we ran into was swabs, and that has been, you've seen that this past weekend. The governor of Michigan, many have talked about how problematic this supply chain issue has been. I'm not going to share all of that, but what I want to say is this. I want you to know that we are humbled, thrilled, and excited that Merit Medical answered that call. One thing I've learned over these years, if you want something done, tell Fred he can't do it, and it will immediately get done. That's what Fred does best. So I'm going to turn the mic over to Fred Lampropoulos, the chairman and CEO of Merit Medical, and he will talk about the results and the incredible ingenuity that is happening here. Following Fred, we will be privileged to hear from Ben Hart with the Governor's Office of Economic Development. He has really been leading this push to find innovative solutions in Utah and across the globe. And then following Ben Hart, we will be privileged to hear from our Governor, Gary Herbert. Fred.
Well, good afternoon, ladies and gentlemen. I will say that our project was not as hard as putting these microphones together, for starters. Thank you for coming today. Lieutenant Governor, ladies and gentlemen, we're delighted to have you here. You know, it seems just a few days ago, but about 2.5 to 3 weeks ago, Governor, we sat in a meeting. A week after that, we sat in my office, and you brought members of your staff and from GoEd here. And we talked about this incredible need. I think that has been really reinforced over the last day or two as the President has now called forth the Defense Authorization Act. And I think that speaks to the challenge of this little fellow right here. It's a swab, and this is what is used to be able to gather a sample. Now, I want you to know that I've had personal experience with this. This is something that I was tested on, and it is very inconvenient for about 2 seconds, but not quite as bad as a shot. Anyway, we sat down with members of the state lab and with others and talked about the need. And in a matter of now 2 weeks, we have spent every day, every weekend, every evening here with a group of about 15 engineers who have helped to develop the swab, the testing kit, and it's a lot more complicated than just the two of these. It has to do with packaging and sterilization and boxing and labels and marketers, and if you really knew the extent of a project like this. We had a project meeting last night that I think we had 43 people on in various aspects, from quality to engineering to regulatory, operations, shipping, transport, our chief operating officer, our vice president of research and development, a lot of people involved. But this isn't just about Merit. This is about our partners at Deseret Laboratories in St. George, with GeneStat in St. George. We have collaborated, but it was really the state. It was really GoEd that brought us together and said, well, these guys can do this, can you guys do that, and can you come up with a product? And in just a few short weeks, with a lot of effort from a lot of people, a couple of visits down to St. George, the last one yesterday with a group of engineers, we have now started production of this product, and we hope to be able to do 10,000 of these a day, and in a very short period of time ramp to 50,000 units a day. Now, that sounds like a big number, but that'll just meet the orders we've already received. The real issue is how do we then ramp it up from there, recognizing that at some point it will come down. But there's something maybe even more important, not only to the patients, but for the people and the jobs that it will maintain. It's not a lot of jobs, but they have to be molded, they have to be assembled, they have to be packaged. And so in many ways, this is so much more than just a swab that will help a physician, will help a patient, will help us to control the most horrible thing that has happened I can remember in my lifetime. And I've seen a lot of unfortunate things. So to my partners who came all the way up here today, I appreciate you guys being here. To Governor, to you, to your staff, I appreciate this will make the difference between life and death. Think about that. If we know about it, we can treat it. So Governor, I thank you, your staff, all the things that you're doing, and the opportunity to be here to just speak a little bit about Merit Medical. 6,500 employees, about a third of those right here in Utah. This is Mother Merit right here on this campus, and we've been in business for 32 years, and we've been saving lives for 32 years. So I thank you. I thank you, Ben, for all that you've done for us and helping us get us together. Here you go, folks. I'll turn the time now over to Ben. I think it's your turn. So thank you very much, ladies and gentlemen.
Thank you, Governor, Lieutenant Governor, and Fred. It's an honor to be here with you at this press briefing today. I will say this is incredible and an exemplary witness, what we're seeing here today, of social distancing. I wouldn't expect anything less from one of the world's foremost life sciences companies. So, Fred, it's an honor to be here at Merit Medical today. It's an honor also to speak to a little bit of my role and to my office's role and the team that I get to be a part of day in and day out. I never thought that one of the highlights of my career would be trying to help find swabs for the state of Utah. But those are the times that we currently live in, without question. So when I got the call a little bit more than a month ago from the Lieutenant Governor and his team to come be part of this effort, specifically to help with testing, I was anxious to help, to see what I could do. And I will admit that I have become really, really passionate about testing. I believe it's one of our, not only the backbone of our strategy here in the state of Utah, but it really allows us to work with the private sector, incredible private sector members and businesses like Merit Medical, like we're seeing here today. So our team, it's led by Nate Checketts with the Department of Health. Under the Lieutenant Governor's direction as chairman of the Coronavirus Task Force. And I'm also partners in crime with Robin Atkinson Dunn, who's the head of the Utah State Lab, and is really, I don't know if brains is the appropriate way to say it, but technical expertise is probably more appropriate, but definitely the smarter part of our partnership. And so she has been with me every step of the way. The background story on this is when the Lieutenant Governor and our team under Governor Herbert's direction, we recognized about 3 weeks ago that this shortage was coming. We recognized that it was getting very tight in the market. We understood that trying to find these little pockets of swabs here and there was really, really difficult. It wasn't like other PPE, as we're affectionately calling them. It was different. We knew that there was going to be this shortage coming. When the Lieutenant Governor offered to put out a tweet and basically a call to arms for the state of Utah, he asked me if he could put my email address down. I was a little bit reticent. I understand the Lieutenant Governor has a lot of social media followers. It was a Friday night. It was 5 o'clock. I was just getting ready to check out for the conference weekend, and I knew as soon as I saw my email in his text that my weekend had been commissioned. And so several news outlets picked up the story. They picked up my email address, and we went to work. We went late that night. We started early the next morning doing phone calls on the East Coast, all around the world, trying to find a short-term fix for these swabs. We knew that, again, this is the backbone of our testing strategy. Testing is so important. It's really the first domino that falls. If you can't test, if you can't get an accurate swab, it's hard to do just about anything else in our coronavirus response. So we've become very passionate about finding the right swabs. Thankfully, with the good help of Robin and others, Chris Hughes at the Utah State Department of Purchasing, we were able to find a short-term fix, but it didn't give us the long-term solution. And that's what we're talking about here today is partnerships. Partnerships matter. They're what separate us from the rest of the country. It's why we're number 5 and closing in on number 1 when it comes to per capita testing in the United States. It's because we know how to reach across not only state agencies, but across into the private sector as well. So I had made a lot of phone calls, and quite frankly, I had had very little success. And I know everyone else on our team had had very little success in trying to procure swabs. We knew this shortage was coming that has now hit the headlines over the weekend. And so thankfully, as soon as that tweet went out, I thought, I need to call Fred. We felt like we had a real champion in the state of Utah, in Fred Lampropoulos. And so I wondered what the response was going to be. I had had so many doors kind of slammed in my face in very polite ways that I just didn't know, and I wasn't real hopeful. And he never questioned, he never looked back. He said, we're going to do what's right for the state of Utah. And Fred, I don't know if I should say this, but he said, I don't care if I make money on this. He said, I'm going to do what's right for the state of Utah. And that's when we knew that we had a real partner and a real champion in Fred Lampropoulos. And so his team, as he alluded to, has been working this nonstop over the last 3 weeks. They have become real champions of this effort. We have been hearing the national headlines. We've been reading the national rhetoric. We know that this is an impending shortage not only nationally but internationally. And here in Utah, because we learned to work together 3 weeks ahead of the crisis instead of the day of, we're prepared. And it's good leadership that comes from Governor Herbert, Lieutenant Governor Cox, and Fred Lampropoulos that have put us here in this position. Where other states are having to now ramp down, their response is becoming less effective. We're able to ramp up with testing because of partnerships with, that we're talking about here today. So Fred, thank you to you and your team, your tireless efforts, Governor, Lieutenant Governor, and to all those who are involved. We're all supporting those who are on the front lines. We all do what we can to help out, but today is a banner day for the state. Today is the day that we really, really understand just how fortunate we are and how well ahead of other states we are when it comes to working together. And so with that, I'll conclude my remarks and turn the time over to Governor Herbert.
One, I'm honored to be here. Thank you very much, Fred. Thanks for hosting us. This is not an easy thing to do, as we've seen demonstrated here. Technology has its limitations, and finding the right guy. But I do appreciate the fact that as I came in, I see understand, innovate, and deliver as your slogan. So on our red flyers here. And really that's an example of what Utah's been doing. We innovate, we understand the problem, we innovate, we find creative ways to solve the problem, and we deliver good results. And we're doing that in Utah when it comes to the COVID-19 issue better than probably any state in America today, certainly as good as any state in America today. And I appreciate the fact we've come together as a community. The people have followed our directions. The private sector is stepping up, as we see here today, in a significant way in trying to find solutions to the unique challenge we face today. And it's so unique that none of us have ever seen anything like this in our lifetime. And again, I appreciate and offer thanks to those who've been part of the team. You've heard it mentioned, about testing. I hope that testing doesn't just fall on deaf ears because we've talked about it so much. But a key for our success in slowing and stopping the spread of the coronavirus is finding out who's got it. So we can be more surgical in our isolation, so we can stop and treat those who need it and protect those who don't have it. So testing is a key issue. And we've been trying to ramp up, and we've ramped up. In fact, we're one of the best tests per capita in testing in America today, in the top 4 or 5, and getting better, by the way. And yet we still want more. And we have some issues that have caused us to slow down and some pinch points. Again, I appreciate that today we have 4,047 tests were done yesterday in the state of Utah. And that's a high water mark for us. We hope things continue. And certainly with what we're announcing today and with the help of Merit Medical, we're going to eliminate some of those pinch points. One of the pinch points is having swabs. Who would ever thought you'd run out of swabs? That's something that we're all a little puzzled about. But again, as we've had Merit Medical step up, understand the problem, innovate a solution, and have come up with a swab now that I think that most people would say, if it's not the best, it's certainly close to being the best. And Dr. Robin Dunn, we can have you maybe weigh in your opinion. But I sat down there as we went through the different kind of swabs, the vials, And Dr. Dunn talked about how this is one that will work better. It's the right size. We need to have a place where it breaks off in the vial. How can we put these little bristles on the end that will work more effectively? And so that just communication. And then Merit Medical, who'd already been working on this, as you've already heard the story, went to work 24/7 around the clock to see if we can develop this kind of a swab and this kind of a vial and put that as part of a kit. They had one other problem, reagent. We've heard since the beginning, do we have enough reagent to actually complete the tests and deliver the test and find out the result? And unfortunately, we have not had. So again, what Merit Medical is doing is they found a way. We got a recipe for them from Wyoming. We talked to the governor up in Wyoming, and he helped us with that. And that's something that Merit Medical will start producing too. So not only the swabs and the vials, but the reagent will all be produced here locally over time, giving us the ability to supply our needs when it comes to this testing pinch point that we've had. It's going to help us to do more tests. So I appreciate the work of Merit Medical. Again, I appreciate, I've not been much of a tweeter, but the Lieutenant Governor's a big tweet. And he's been tweeting and with Ben in our GoEd office saying, we need help. How can we get to the masses and ask for help and assistance? And so with a tweet that was put together by the Lieutenant Governor and our COVID-19 task force, and with Ben's help, interaction with Merit Medical, this collaboration came together. And again, the significant results we see here. So again, understanding the problem, innovate, and now we are in fact delivering thanks to Merit Medical and Fred Lampropoulos and your team. So we thank you very much for that effort. We've ordered as a state now 400,000 of these testing kits with these swabs and the vials and the reagent. And we appreciate the fact we're going to have some. And we're going to have enough for our needs. And I hope, Fred, that this continues to grow, and not only enough for our needs, but I talked to the governor of Nebraska the other day, and the governor of Wyoming, and the governor of Nebraska, and Iowa, and they say we need more testing. And I expect that this is we're going to help not only our state, but beyond our borders into the country, and maybe beyond the borders of our country. So, again, a great opportunity for us to have a solution here being developed that we can share with others. Let me just conclude by saying, again, things don't just happen. We react to things that happen. We don't have a lot of ability to change what's happened with this coronavirus and how it acts on us. We can control how we react to it. And I appreciate, again, the people of Utah reacting in a positive way, finding ways where they can provide service, find niches in the marketplace that they can help others, their neighbors, people they don't know, even strangers. And again, we have a wonderful state because we have wonderful people. And so I want to say thanks to all of them, and certainly thanks to Merit Medical here today too. With that, let me add one other additional announcement here today. Over a month ago, our hospitals and doctors, dentists, other providers of health care began virtually on their own accord of saying we're going to limit elective surgeries. Recognizing as we had this threat of the coronavirus that if we had a surge in infections and people that became infected with COVID-19, that there's going to be a potential shortage of not only bed space, particularly ICU rooms, but a shortage of gowns, masks, serums, medicines, the things that you need to have to take care of people in surgery and other medical needs inside of a hospital. And so the concern for that caused them to say, we're going to slow down on elective surgeries so we don't run out of bed space and materials that we need to treat COVID-19 patients. On March the 3rd, our state health department, in fact, issued an order formalizing the postponement of elective surgeries. And that was, again, a willingness for the good of the whole to take some sacrifice, a significant financial loss to our hospitals and healthcare providers. And I appreciate them being willing to, of their own accord, step up and following the order that was more formalized by our health department. So I'm very pleased today to announce that we'll be instructing our medical providers throughout the state to resume elective medical procedures in a measured and cautious way. This is in accordance with the recommendations that come from our COVID-19 task force chaired by the Lieutenant Governor, as well as our new Public Health and Economic Emergency Commission. Both are in concert as far as the recommendations to us as far as what we should do. And I appreciate the fact that we have an opportunity now to incrementally move back into a more healthy economic environment and take some of the restrictions that we've placed on the marketplace off. Now, this is not an on-off switch, as I mentioned before. This is more of an incremental dial that we're twisting here. I want to again say how much I appreciate the hospitals and doctors and medical team for their willingness to work closely with us on this action. And also thanks to the willingness of Utahns across the state who've been willing to postpone and do their part in saying, I can have this elective surgery maybe in a couple of months as opposed to right now. And again, thanks to the people of Utah in following the directives. You know, we've had some remarkably good numbers, but that's because people have been willing to, in fact, embrace social distancing, stay safe, stay home, just only essential travel. The hard things we've gone through these last 6 to 7 weeks have borne a good positive result. And so we should thank the people of Utah for following those guidelines, which has given us the ability to not have this surge in those infected with COVID-19 and allows us now to resume elective surgery, at least in an incremental way. We also, again, the hospitals have said to us as we work together on this, that they have the supplies and they've ramped up the supplies of personal protective equipment that we're capable of meeting the needs we see, certainly in the short term, and working to make sure we have it for the long term. We've seen, in fact, the data on our transmission rates have now slowed down, and it appears that it's to be decreasing. That's a good sign. And the growth of new hospitalizations we see now due to the COVID-19 has decreased. So those are two good numbers that allow us to have confidence in moving forward here with elective surgery. It's also probably important to note that some of these elective surgeries that have been postponed over the last couple of months have become more critical, maybe more urgent now. So this is a good time to have this to happen, and we're grateful for the data which drives us is allowing this to take place, and we are sensitive to the needs of the people out there that need that. So again, I'll just remind everybody, I will direct today the Utah Department of Health to amend their March 23rd order to allow the resumption of elective procedures pursuant to guidelines established in consultation with our hospitals and our other medical providers. So that's a good piece of information, a positive thing today that we're announcing. Let me just remind everybody, this does not mean the pandemic is over. It means that we're moving in the right direction. We still need to be diligent in maintaining our social spacing, as you see the efforts that Merit Medical's gone here to make sure we do that here today. And we're going to monitor what's taking place, and if the rate happens to trend back up again, we may have to make some adjustments and adjust our protocols. But we're in a good place. If we continue to do what we're doing, we should in fact continue to have better, and I'm just very cautiously optimistic that we're in a very good place here in this fight against the coronavirus. So again, Red Letter Day today on two fronts. Certainly we appreciate you, Fred, and what you've done. I can't imagine. I mean, these folks have been working literally 24 hours around the clock to find a solution to this need that we had here, and in 2 weeks' time they've done it, and we appreciate and applaud their effort. That's the power of the private sector. With that, if there's any questions, we can rotate through here and answer any questions you may have. Anybody from the press? Yes.
Hi, thank you. I know that in the last few days, Michael Good at the U has said that University Hospital's surge capacity was only barely enough to meet the peak that's anticipated in mid-summer. So I'm wondering, could resuming elective surgeries now, before that anticipated peak has occurred, disrupt that balance and overstress, I guess, at least that hospital system's supply of bed space and ICU space?
Okay, I don't know, Lieutenant Governor, if you'd like to address some of that. I'll just, before he comes up, just say this is all being done in collaboration with the Hospital Association. So this is not something we're doing as kind of a rogue position. This has been done in collaboration and discussion. Models have changed over time, by the way, and we've had models have to be revised and lowered, which is good news. We're doing well enough that they've had to reduce and lower some of the numbers they thought we were going to be at this particular time. Had to cut them in half by 50%, and we're still lower than some of the models they had out there. So, again, what they anticipate, what they thought they needed to have, we are much below that, and we've now had also an increase in medical supplies and gowns and masks and those kinds of things too. So, those kind of offset.
Thank you, Governor. Thank you for that question. It's important to point out that Dr. Good is a member of the commission that recommended this. And two things are important. As the Governor said, this is not just a light switch. The recommendation is not to begin all procedures and all elective procedures, but instead that the Hospital Association will come up with protocols and guidelines to safely resume those protocols. What's important is I think what you'll see in those recommendations, and I know they're working on it and hope to have those out very soon. It's mostly outpatient procedures that would not take up bed space, and making sure that again the hospitals and surgical centers have enough PPE on hand for any future surge that might come, as well as testing those who are getting the procedures to make sure that they're not infected. One of the things that we have seen from some of the testing that has been done in other places in New York, for example, when they were testing women who were coming in to deliver babies, they found out that many of them were testing positive and were asymptomatic. And so the patients will need to be tested before having surgery to make sure that they are not COVID positive, and that will also help prevent the spread and prevent any long-term damage that may come. So these next steps are being formulated now and will be released as soon as they're ready.
Thank you, Spencer. Other questions? Anything for Fred?
Yeah. Can you tell us, did you already make swabs here, or do you have another product that you were able to retrofit, like the production line?
We have never produced a swab before. This is something that the need was there, the request was there, and it came from nothing to what you see in 3 weeks.
And you mentioned that 50,000 a day was the capacity you're hoping to ramp up to, and that would only just meet the orders you already have?
Yeah, if we talk about 50,000 a day, and we look at that over a week, and then over a month, it's pretty substantial. So we will ramp up to that. We are also doing tooling. So we will make our own vials, and then we're working with Deseret Labs and our other partners in St. George to do the reagent. So we're going to be able to meet all the needs, I think, on a local or regional basis. We're having calls from Idaho, Wyoming. We've even had calls from FEMA. But our commitment, which is very important, was to the state of Utah. They're in the front of the line, and they will stay there until those needs are met. And then we'll look at it as a business beyond that and see where we can go from there. So we'll go as far as we can see, and then we'll see how far we can go. So.
Hey, try to use that sometime.
I think I'll use that sometime, so thank
Any
you.
other questions?
Yeah, question over here. One for each of you. Fred, one, how many of these kits have you produced so far?
It started in production today, and that is for the swabs, and then our partners are gathering, and they'll be building the reagent and sending that to us. We'll package them up together, and they'll end up in a kit with one vial, one swab, and one biohazard bag to be able to put the paperwork in and be able to pass it on for testing.
Gotcha. And then, Governor, you talked about slowly bringing things back online around May, and one of the big obstacles to that is the lack of testing. Does this help get you closer to that goal? How does this play into that larger picture?
Clearly, we want to have, it would be nice if everybody could be tested at one time. We could see where the people are that have the infection and isolate and have more surgical approach to, in fact, save others from catching the infection. We will be talking tomorrow about a new app. This is an example of technology here, but we have a new technology we're going to announce tomorrow that's going to help us find where people are bumping into each other and maybe catching the infection. So stay tuned for tomorrow on that. Testing is clearly a big deal, and it's been the lament of every governor since the beginning of this issue. And we've taken a significant effort to get more and more testing. Silicon Slopes, as you know, has stepped up with their own efforts to help us with testing. TestUtah.com, you can go there and you can get an assessment and see if you need to have a test. We have about 48 now places you can test, and that's good. We want to have people to have, right now it's kind of, you have to have a symptom, even if it's mild symptoms, to get tested. We'd like to get to the point where anybody who wants to, if you're just curious, can be tested, so we can find out what your health condition is going to be. So this is a significant help towards us being able to do more. We'd like to be doing 5,000 to 6,000 to 7,000 a day. We at 4,047, I think yesterday, is our high water mark, so we could double that and be happy.
Hi, Governor. My English is not that good. I'm going to try my best. I've been hearing a lot of Hispanic people in Utah, like they are not having enough options of help because a lot of them are undocumented. They don't have the papers. They feel in the process. They feel like the government is maybe it's not making like a path for them, like a special help for them. If there's any way you can give us information about where they can go, because right now they're having that issue.
We can, and we're very concerned about that. There seems to be a disproportionate amount of our minority population that have been infected. That may be because they don't have access to as good of health care. Maybe they're afraid to ask questions and get directions. So I've asked Lieutenant Governor to come and speak to that issue, and he can speak Spanish to you too.
Claro.
Habla español.
Get right.
Unfortunately, we do know that there are disparate outcomes when it comes to this disease. We saw that originally with the numbers out of New York and Michigan, that our multicultural communities tend to be hit harder with this. So the governor asked us to address that. Again, later this week we will be making an announcement. We've been meeting, formalizing a subgroup of our task force that will work specifically with our multicultural communities. We've been translating the materials into 14 different languages, but that's not enough because the information isn't getting out to people. And so we're working with community leaders, specifically in the Latino community, which is the community that has been hardest hit by this, both with the rate of infection as well as the rate of hospitalization in the Latino community, and we need to work with them. Look, this disease doesn't care the color of your skin. It doesn't care what language you speak. It doesn't care what country you come from. It doesn't care about any of that. And if we're going to slow the spread of this, we have to slow the spread of this in every community. And the governor has been very concerned about that. And so I believe, although they're working now, on Thursday, we'll be giving more information about who is on this group. They're formalizing that today. But more importantly, trying to work through those health disparities. We also have mobile units now that can go out where we see these hot spots, and we are seeing hot spots in the Latino community, and they can go out and do testing on the ground. Again, no paperwork is needed, none of that. We want people to get tested and to get treated, and then finding places for them to isolate if they don't have a place, so that they don't spread the disease to family members. Todo eso es muy importante para las personas latinas que viven aquí, y queremos que ellos tienen la ayuda que necesitan para que no sufran más que necesitan.
Gracias, amigo. Okay, any other questions? We'll give two more. You, and I'll give you the last one. Okay, go ahead.
So you guys were talking about the fact that like 3 weeks in advance you were seeing this shortage coming, and so you started to prepare for it. Are there things that we've learned from this past 3 weeks that we can apply throughout the duration of the disease as well as afterwards, that we've been like major, things that we've learned to help us going forward?
I guess one of the things that I've learned is that things can happen that are unexpected. And the question is, how do we react? I remember when I was lieutenant governor, not that long ago, that I had a friend of mine, Mitch Landrieu, who was the lieutenant governor in Louisiana. And he then became the mayor of New Orleans. but they had Hurricane Katrina and Rita. And so he asked me to come down and take a look, and the devastation was just horrific. It was hard to even comprehend. I was in a helicopter, they flew me around the area, and of course the levees had broke and flooded 2,300 homes. And that's just a number, 2,300 homes, but that was like having damage and destruction to all the homes in Utah County and a third of the homes in Salt Lake County. That's how big of a swath it was and how much devastation. And they weren't prepared. And so I came from that experience, and we created in Utah what we call Be Ready Utah. Be Ready Utah, people say, be ready for what? You fill in the blank. It could be fire, flood, drought, pandemic. You know, are we prepared? And we're better prepared than most states because of that organization we started, which has been replicated in some ways by FEMA, by the way. But it started here in Utah because of an observation I made in New Orleans and saw that destruction of Hurricane Katrina and Rita. And I thought, boy, one thing we ought to do is be prepared for the unknown. We have a 12-step program. You can go to the Be Ready Utah site. It tells individuals what they should be doing to be prepared for whatever. It tells what families should be doing. It says what businesses should be doing to be prepared. And it says what education should be doing to be prepared. And, you know, the simple things, the 72-hour kits, where's your medicines, what do you do about your pets, your elderly people. It has a list of what we should be doing. That's helped us be better prepared. And we had kind of a double whammy because we thought in terms of earthquake. We started out of that program, or the Great Shakeout, which is coming up here, I think, pretty soon. The Great Shakeout, which prepares us for earthquake. That's what everybody worries about. And we have a drill every year where we go through that process. And guess what? Right in the middle of this pandemic, in this early beginnings, what do we have? An earthquake, and a pretty major one, which has had over 1,200 plus aftershocks since that time. So we've learned to be prepared, and this is just an example of reinforcement. It's hard to predict the future. What's my favorite philosopher, Yogi Berra, say? I hate to make predictions, particularly about the future. So be prepared, and it's a real thing. And in Utah, we are better prepared than most any place in America. Okay, last question. I hope it's for Fred.
Actually, I think it might be, or maybe for Mr. Potts. I think I'm a little confused about the steps of the testing process. I understand you've got the vials and the swabs. Who gets the reagent? Where does that process occur? And is it,
Yeah.
has this all
I
happened?
think Dr. Dunn would be the best person to answer that. Dr. Dunn? Is that okay, Governor?
I think that's a
She's the boss when it comes to that, so.
Two types of reagent, that's what's confusing. A transport reagent and then the extraction reagent.
Okay, so that's a transport reagent.
This is a
goes
transport
in
reagent.
the little vials there? Go ahead, I'm sorry.
No, you're good. Hi, I'm Robin Atkinson Dunn. I'm the Public Health Lab Director. And so this is the system that we call sort of a collection kit and a transport system, basically. So this includes the swab, which is what actually goes into the patient's nose. It has the vial and what we call the transport solution that the swab goes into. It caps off, and then that is what gets sent to a laboratory to actually perform the testing on the patient specimen. And so what Merit Medical has created here is that sort of full kit solution. It's got the swab, it's got the transport media from their folks down in St. George, and then it's also got, which is a unique thing to this kit, is it has the biohazard bag the specimen has to be transported in. Most kits don't come with that, so we thought that was a nice little touch to add that, because you definitely need all of these in order to take that sample and get it safely to the lab. Does that answer your question?
Absolutely, that really clarifies a lot. Thank you.
Okay, you're welcome.
Can you tell us more about the design of the swab? It sounded like you had weighed in on needing to have little hairs or something.
Yeah. Someone else may better know about the actual design.
Yeah, I think if we could, there is process, know-how, and intellectual property, and we prefer to keep that private at this point.
But you can look and see the finished product by coming up here and looking at the swab.
I should say it's a lot more complicated. I know that our engineers will reaffirm this. It has to break at the right place. It has to reach the right place. It has to be flexible. It has to collect enough material so that they can measure it. It has to, again, go into the reagent. There are several types of reagents. and then get put in the right thing with the right information to make sure that you don't mix up patients. So it looks very simple. It's not.
I can attest to that. I had no idea what went into making a swab. I just knew what it had to look like, basically, and what it had to do. So I've actually learned a lot about this process. It's pretty complicated, and I'm absolutely overwhelmed with what they've been able to accomplish.
So given the optimized design of these, I mean, it sounds like the supply of swabs that Utah has had so far was kind of cobbled together from little sources here and there.
Correct.
Were those, I guess, suboptimal swabs that may have resulted in false negatives?
I wouldn't call them suboptimal. It's just when you're dealing with swabs that are maybe coming from other countries or sources that we're not used to dealing with, you do want to make sure that the swabs work correctly. And all the swabs that have been used, at least out of Utah, and what the state has delivered, were all vetted and validated to make sure that they would produce the correct results, even if they were cobbled together.
This is the new and improved model. And we thank Merit Medical and Fred and his team for going the extra mile. This has really been for the love of Utah more than anything else. And so I just want to personally thank Fred and Merit Medical for the good work. This is a significant step in the right direction for us as a state and hopefully for the country and the world. So I applaud Fred.
Thank you. And to my partners and my
And your
engineers,
partners.
thank you.
It's always a team effort.
Thank you very much.
Thank you all.